for the procurement of the vaccine. To give us more details, we have Gerard de la Peña. He's reporting live from Mandaluyong City. Gerard, will this Moscow-developed vaccine be available anytime soon?
Well, Charles, Russia claims to be the first one to have come up with the vaccine that would keep COVID-19 at bay, but the Department of Health says that this doesn't mean that this vaccine will be immediately distributed here in the Philippines.
The Russian embassy announced that Moscow has developed a vaccine that would help prevent COVID-19 infections. In fact, the vaccine has already been registered in Russia. The embassy said even Russian President Vladimir Putin's daughter participated in the clinical trials. President Rodrigo Duterte hopes the Russians can make the vaccine available for Filipinos. But some citizens are apprehensive about the Russia-developed shot.
Para sa akin, parang hindi ko muna para sa akin kasi hindi ko pa nasubukan sa ibang tao.
Lumalabas sa FB po na maraming hindi ka daw pwedeng magpaturo kasi nga nakakamatay daw yung iba.
Health officials also clarified that Filipinos cannot be immediately inoculated with the vaccine once it reaches Philippine shores.
Even though dumaan na yan sa mga regulatory procedures sa Russia, pagdating yan sa Pilipinas, dadaan pa rin yan dito sa atin na mga procedure.
A panel of vaccination experts has informed the DOH of the various vaccines already under development. The DOST is already in talks with Russia's healthcare ministry for the procurement of the vaccines, but protocols for its clinical trials in the country have yet to be drawn.
We cannot really say kung sino at kung gaano kadami ang sasali. Kailangan din natin ma-determine ilan ba yung ipoprovide itong mga manufacturers, ilan ang papayagan na isali sa clinical trial dito sa ating bansa.
The Health Department has earmarked 2.4 billion pesos in the 2021 national budget for the procurement of vaccines for about 20 million Filipinos. Even other agencies like the MMDA have already set aside funds for the vaccination of their employees. Meanwhile, the DOH said the Japanese drug Avigan is already in the country. Clinical trials will begin soon with 100 patients from the Philippine General Hospital, Santa Ana Hospital, Dr. Jose Rodriguez Hospital, and Quirino Memorial Medical Center expected to participate.
Charles, the DOH said the DOST is currently in talks with Russian health representatives and that the outcome of that meeting will be announced very soon. Charles.
Thanks for that, Gerard. That was Gerard de la Peña reporting from Mandaluyong. No less than the Health Secretary himself, Francisco Duque III, is on the fence about Russia's COVID-19 vaccine. In a presser, the health chief said the details are insufficient on what Russian President Vladimir Putin calls the first registered coronavirus vaccine. Dubbed as Sputnik V, the vaccine is still undergoing clinical trials. US-based group Trial Site has warned that the Philippines should be cautious in trying out this vaccine.
Duty of government is to ensure that it is safe to use and it is of quality. We have the regulatory agencies to ensure that all those standards are met of safety, efficacy, and quality.
But if the country has to send someone over as a guinea pig to try the vaccine, it should definitely not be President Duterte. In an interview with Sa Totoo Lang on 1PH, Task Force Special Advisor Dr. Ted Herbosa said the chief executive is not qualified. He said high-risk vaccine trials are usually tested on individuals aged 55 and below.
Honestly, hindi siya qualified, no? Ako yung unang magsasabi, ay, huwag muna sa'yo. So give it to younger people with a strong immunity.
COVID-19 cases in the country have surged to 143,000. More than 4,400 cases were added to the tally today. 59% of those new cases are from Metro Manila. Out of the total confirmed cases, around 72,000 are active. 93 additional COVID-19 fatalities were reported, bringing the death toll to 2,400. Total recoveries are approaching 69,000, as the DOH records more than 630 new survivors today. The House of Representatives approves a new bill that sets standard health protocols amid the pandemic. The Better Normal for the Workplace, Communities, and Public Spaces Act of 2020 seeks mandatory wearing of masks, availability of hand washing and sanitizing stations temperature checks and physical distancing of at least 1 meter in all public spaces. A total of 242 members voted unanimously to pass the measure. It is now up for approval in the Senate. Let's pause for a quick break. One News Now will be right back. You're still watching One News Now. I'm Charles Lejano. A House leader has dared PhilHealth officials to sign bank secrecy waivers to pave the way for an investigation by the Anti-Money Laundering Council. But even before he could respond to this challenge, PhilHealth President and CEO Ricardo Morales had to leave the chat room as he was not feeling well. To give us more details, Ria Fernandez reports live from Quezon City. Ria, what do we know so far based on the House hearing?
Charles, some PhilHealth officials took on a lawmaker's challenge to disclose their bank transactions. In the same hearing, though, some representatives of the agency admitted to receiving allowances from the accreditation fees by hospitals. House lawmakers continued to quiz PhilHealth over the alleged rampant corruption in the agency. Deputy Speaker Elry Villafuerte dared PhilHealth officials to disclose their bank transactions to the AMLAC. Officials present in the hearing accepted the challenge, but Morales, as well as EVP Arnel de Jesus and Legal Chief Rodolfo del Rosario Jr. eventually left the virtual hearing due to medical reasons. Meanwhile, House Public Accounts Chairperson and Anak Kalusugan Representative Mike Defensor reiterated that the so-called PhilHealth mafia thrived due to the agency's all-case rate policy, where PhilHealth pays hospitals on a package rate for a certain disease, regardless if actual hospital fees are lower. Defensor noted that the Commission on Audit has time and again flagged the said policy since its implementation in 2013. Citing COA, the lawmaker added that PhilHealth also paid several hospitals despite the absence of claims. With this, Defensor is convinced that a collusion between hospitals and PhilHealth exists. He is also bent on filing plunder charges against PhilHealth officials down to those at the helm of its regional offices. In the same hearing, PhilHealth Senior Vice President Israel Pargas and Renato Limshaco Jr. admitted receiving allowances out of PhilHealth accreditation fees made by hospitals. But when Deputy Speaker Dante Marcoleta tried to probe the amount, Limshaco suddenly cleared himself.
Sorry po, talagang hindi ko matandaan po kung magkano yung pera po na binibigay po sa ating mga recipient po noon. Dahil po ako ay hindi po ako isang medical officer po na binibigyan po ng ganong allowance dati po, Mr. Chair, Your Honor.
In defense, Pargas said the practice started in 2008 and was based on a board resolution. He said each of them received around 20,000 pesos yearly, but it was eventually disallowed by the Commission on Audit in 2014.
Kanina sinabi niya, meron silang monthly tinatanggap. Siya mismo nagsabi, naka-record tayo eh. Ngayon sinasabi na naman niya, hindi monthly. Paiba-iba ang sagot ng mga tao na yan.
At this point, some lawmakers were convinced that PhilHealth officials are just covering up for one another. With his Deputy Minority Leader Carlos Zarate described the state insurer as having a failed system. Minority Leader Benny Abante ordered the agency to submit further details on accreditation fees paid by hospitals. The state insurer said it collected an average of 27 million pesos of the said fees for years 2018 and 2019. Charles, the House committees hearing the alleged fraud in PhilHealth will immediately issue a subpoena for the SALNs and ITRs of the officials of the state insurer. Meanwhile, they will also release a show cause order against the PhilHealth officials who missed or skipped the hearing, including General Morales. Charles?
Thank you. That was Ria Fernandez reporting live from Quezon City. The Health Department defends PhilHealth's huge amount of cash advances to the Southern Philippines Medical Center in Davao. The interim reimbursement mechanism, or IRM, for the said hospital is at 326 million pesos. That's higher than Philippine General Hospital's 263 million pesos. But no comparison should be made, says Health Undersecretary Maria Rosario Vergere, as the IRM for the Davao Hospital was computed before the pandemic. The palace sees no irregularities in the allocation since SPMC is said to be the country's biggest government hospital facility.
So kung sakasakaling mas mataas, baka yun ay kadahilanan ng kalakihan ng kanilang ospital, maraming beds, maraming pasyente. Pangalawa, high technology rin sila and they cater to different or varied types of patients.
Over in the upper chamber, Senator Juan Miguel Zubiri has proposed to suspend PhilHealth's IRM until the agency's anomalies are resolved. Task Force PhilHealth is set to meet on Friday to lay out their strategy. Headed by Justice Chief Minardo Guevara, the task force is composed of representatives from the DOJ, the Office of the Ombudsman, the Commission on Audit, the Civil Service Commission, and the Office of the President. Resource persons will be invited to brief task force members on alleged irregularities in PhilHealth. The meeting will be held at the DOJ headquarters in Manila, but members can participate via video conference. The family of slain activist Randy Echanis hopes that his body will finally be released. This after fingerprint analysis proved that he was indeed the man killed in Quezon City last Monday. Ryan Ang with the details.
Police officers on Wednesday prevented the holding of a holy mass in front of the Pink Petal Memorial in Quezon City, where the body of activist Randy Echanis is being withheld. They said mass gatherings are not allowed in Metro Manila under the prevailing quarantine restrictions. Because of this, a solidarity prayer was offered for Echanis instead.
Kahit na meron tayong health protocol measures na ginawa katulad ng physical distancing at nag-alcohol naman tayo, and I'm sure lahat naman dito ay ayaw magkasakit, hindi tayo nakapag-misa ng full-blown.
Echanis' wife Erlinda is hoping that authorities will release the body on Wednesday after the results of the fingerprint cross-matching exam came out positive.
Ang hinihintay na lang natin ay madala siya for autopsy.
The Quezon City Police District earlier identified the body as Manuel Santiago based on an ID recovered from the crime scene. On Monday, they intervened during the cadaver's transfer, bringing it to another funeral home due to a supposed lack of a release order. Authorities also arrested a paralegal staff who was guarding the body. In a statement, the Free Legal Assistance Group condemned the killing of Echanis and the person alongside him named Dewey Tagapia. The group also expressed outrage at the police for allegedly snatching the body of Echanis from his family. For party list Gabriela, the killing of Echanis, who was the peace consultant of the National Democratic Front of the Philippines, has implications in the socio-political condition of the country.
Kung paanong ang mga naninindigan, lumalaban, kaiba, or oposisyon ang pagtindig sa mga usapin sa pamahalaan, usapin sa ating bayan, ay hindi napapakinggan at pinapatay. Malaking usapin po yun.
Rosas added that the case may reach human rights offices outside the country due to its severity. For News 5, Ryan Ang, We Are One News.
This just in, the Health Department has already set a retail price for face shields. Prices of non-medical grade face shields are set at 26 to 50 pesos apiece. A 10% increase may be allowed for distribution costs to Visayas and Mindanao. For more updates, follow News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime and anywhere. We now throw you back to the House Committee hearing on PhilHealth. I'm Charles Lejano. We are One News.